Hi, my name is Justin Lord from diabetes.co.uk, and today I'd like to discuss with you a condition which is vastly underestimated and widely unheard of in today's society, and that is mainly due to its very subtle signs and symptoms that we can experience in the short term. Now, actually what we're going to talk about is vitamin D deficiency. Well, it's actually not actually a vitamin. It's a very powerful pro-hormone which has an effect on every single cell and tissue within the body. There is a vitamin D protein receptor found on every single cell and tissue within your body. That's just how important this vitamin is to you. Now, if you have a deficiency, which actually most of us do nowadays, for the reasons that we're going to discuss a little bit later on, but if left untreated, we can experience some severe problems like cancer, heart disease, osteoporosis, and interestingly, diabetes. Now, if you are concerned about feelings of muscle soreness, bone pain, depression, and fatigue and weaknesses across your body, now it's definitely worth you signing up for a test with your GP. But it's absolutely essential that you get the correct test, which is a 25-OHD test or a 25-hydroxy vitamin D test. Okay, it's absolutely essential that you get that test done. Now, you might be asking, why are we deficient in such a vitamin nowadays? You know, we tend to think that we get outside and we get enough vitamin D, or we get it in our foods. Now, as an indicator to that, our Paleolithic ancestors and how we were blueprinted on the planet is such that we are meant to be outdoor creatures. Now, way back when we were working outdoors, we used to be able to produce somewhere in the region of 10,000 to 20,000 IUs of vitamin D within 15 minutes of exposure to the daylight sun. Now, we just don't get that nowadays, and that figure is vastly different to the recommended UK dose of only 400 IU. Now, that goes some way to show that we aren't anywhere near the levels of vitamin D that we need nowadays. But let's look at today's society and your life. We just do not get out into sunlight whatsoever. For some of us, not at all. We don't get out of our 3 or our 4 caves. Now, what do I mean by that? Sometimes we'll get up in the morning, we'll stay in our house, we'll have breakfast, we jump straight into the car, we get to the office, we spend all day at the office, sometimes not even emerging from the canteen to go outside at lunchtime. Then we jump back in the car. For some of us, we go home. For others, we go to the gym. That's our 3 or our 4 caves. And we're continually covered over during the day, and we're just not exposing ourselves to sunlight. Now, you might be asking, what has this got to do with diabetes? You only mentioned it very briefly early on, but actually it can have a huge impact if you can just make some subtle changes into your daily routine. Now, in terms of avoiding diabetes and aiding diabetes, vitamin D is actually thought to improve your insulin sensitivity and to improve the production of insulin by the pancreas, which is absolutely amazing news for you guys. Okay, so how can you possibly go and take steps, very small steps in sometimes, just to move yourself forward and improve this insulin sensitivity and get yourself getting over ever so slightly your diabetes symptoms? So what we can do is get outside and expose large areas of our skin to about 20 minutes to 2 hours of sunlight daily. Now, the best time to do that would be somewhere around the early part of the morning before 10 AM and sometime after 3 PM in the afternoon, where the sun is less intense. Now, the exposure of your skin needs to be about 40% of your skin exposed to the sunlight. But unfortunately, our lifestyle is such that we just can't do that. Even myself, I just can't get outside for that period of time and with that level of regularity. And going on holiday once a year, unfortunately, just does not cut it. How else can we do it? we can get various sources of vitamin D from our diet, for instance egg yolks and the fatty liver oils from fish. A lot of the time we don't like fish, a lot of us are scared of the egg yolks. Okay, so in terms of diet it's quite difficult. Lots of foods are actually fortified with vitamin D, but I'm going to talk to you about the types of vitamin D a little bit later on that they are fortified with. Now the third way that you can actually increase your levels of vitamin D very, very easily, if you're not prescribed something by your doctor, is to actually supplement with a vitamin D3 supplement daily. And you're looking at about 8,000 IUs per day. That's deemed to be a very, very safe level. Now, it's important when you are supplementing that you do have the superior vitamin D3, which is highly absorbed at a much faster rate, rather than the synthetic version, which is vitamin D2. Now, this vitamin D2 is the one which is predominantly fortifying our things like milks and eggs and various other food sources out there. So if your food is fortified with vitamin D, make sure you turn over the packet and ensure that it is vitamin D3. If it's D2, don't bother. Okay, so here's some added benefits of supplementing or increasing your levels of vitamin D within your body. There are three fantastic things, okay, and it's something that a lot of us find very difficult to achieve when we're either suffering with diabetes or with weight problems at that. Now, the first benefit is that vitamin D3 will actually enable you to eat less and feel more satisfied by actually increasing your levels of leptin, which is a hormone which says to your body, I'm full up, stop eating. Now that in itself is absolutely fantastic. Some of us find it very, very difficult to close the lid on eating so much food. A second benefit is that we will actually become less of a fat storing machine, and that is due to our decreased levels of our parathyroid hormone. So we will actually become less of a fat storing machine due to the increased levels of vitamin D within our body. Now, the third thing and the added benefit of increasing your levels of vitamin D within your body, interestingly, is that you will lose added belly fat. That tummy fat and that waistline will come in due to the vitamin D's ability to reduce our levels of cortisol, which is a stress hormone, a low-grade adrenaline, which is released by the adrenal cortex, which is in the adrenal glands. Okay, so there is a huge amount of information there from such a absolutely vital vitamin, or alternatively, if we look at it, a powerful pro-hormone within our body, which has protein receptors on every cell and every tissue within the body. This goes some way to describing to you just how important it is to increase your levels of vitamin D in your body right now. Good luck.